Hi, everyone. Welcome to week 6 of your Medical Language 1 course. This week we are covering the chapter on pulmonology. Pulmonology is all about the respiratory system. So we're going to be looking at anything and everything having to do with the respiratory system. So we're going to be looking at the anatomy and physiology. We're going to be looking at some of the diagnostic tests and the medical and surgical procedures, some of those drugs that are used to treat respiratory diseases, and all of those types of things. So, of course, when we think about the respiratory system, the lungs is probably the most common thing that you think of, but there's more to the respiratory system than just the lungs. All of the passageways coming in and out of the lungs are part of the respiratory system as well. So the upper respiratory system consists of, consists of your nose, your nasal cavity, your throat, everything having to do with ENT, so your ears, nose, and throat. That's what we consider upper respiratory system. Whereas the lower respiratory system is the larynx, the voice box, the trachea, the bronchi and the bronchioles, and the alveoli in your lungs. So again, upper respiratory versus lower respiratory. And a lot of times when we talk about disease states, they're going to be separated into those as well. So it's really important that you understand that. So the purpose of the respiratory system is basically to bring oxygen into the body and expel carbon dioxide as waste. So as you look through the process, you know that that's basically what the whole job is. So you're going to look first at the upper respiratory system, so the nasal cavity, so how the air enters the nostrils, what happens to it, how it ends up getting to the lungs through the lower part of the respiratory system. So that's the first part of the chapter, is all about that anatomy of the respiratory system and how that process works, that in and out breathing, how that exchange of oxygen becoming carbon dioxide, how that actual respiration works. And then from there, what we're going to look at is some of the diseases. So many of us are plagued with some of these diseases. Obviously, an upper respiratory infection, most of us have experienced that at some time. Asthma, allergies, all of those types of things affect the upper respiratory system. And then, of course, we have the lungs themselves. So you might have COPD or cystic fibrosis. Those are different disease states that affect the lower respiratory system. Some of those are things that we can, quote, cure. Some of them are things we can treat. Some of them we just treat the symptoms. So depending on what type of disease it is, determines what we can and cannot do. Here's just a few more others. Emphysema, influenza, the flu. Obviously, that's a good example of one we can cure. Whereas, obviously, when we think of lung cancer, there's no cure. So that's the first thing the next thing you're going to be looking at is those different disease states and what part of the anatomy those affect. Then we're going to look at some of those words. How do we put those words together? How do we know when we look at a word? How do we know that it means that we're referring to the respiratory system? So some of those prefixes, pleura and thorax, are prefix, suffix, that help us determine whether or not we're talking about something to do with the respiratory system. Then we're going to be looking at some of the laboratory and diagnostic procedures. Being able to monitor your arterial blood gases is a big one. Here's a pulse oximeter right here where you can tell how much oxygen is in your blood. Pulmonary function test, you might have had to do those before. Here's a pulmonary function test where you're actually blowing to see how much air you're able to exchange back and forth. Those are some of the different tests. And then, of course, there's some surgeries. What can we do to actually fix some of those types of things? And then you're going to be looking at some of the medications. When we think, especially when we think about things like the flu or asthma, those are some of the more common drugs that you're going to be dealing with. But of course, there are others as well. This leukotriene receptor blocker drugs and mast cell stabilizers are both different types of drugs we're going to use with asthma or other breathing difficulties. And then, of course, stop smoking drugs are included in here because obviously the drugs are going to affect your lungs, right? So if you have any questions as you go through this week's material, please make sure that you reach out to me and have a great day.